So it is with great pleasure today that I introduce Joanne Oldford and Bonnie Chipman. Joanne received her degree in physiotherapy in 1993 from Dalhousie University, and she spent nearly 20 years helping the people of this province get back on their feet before branching out into the world of clinical informatics and e-health. And since 2019, she has been practicing as change management specialist at the Newfoundland and Labrador Centre for Health Information, or we call it NLCHI. In this role, Joanne works with clinical stakeholders and project teams to help bring e-health solutions to our healthcare environment to better serve our patients, residents, and clients. And with her is Bonnie Chipman. Bonnie started her career as a medical laboratory technologist in 1992, and she worked in that role until she took the leap into e-health field as a subject matter expert for labs for the EMR project with a national IT company in 2005. After several years in this role, Bonnie returned to the provincial lab program in positions in various labs and laboratory information system. Since 2019, she has been practicing as an EHR consultant at the Newfoundland and Labrador Centre for Health Information until recently broadening to the role of a PHR consultant.
So as part of a national strategy to improve Canadians' access to health information, digital services and tools, Canada Health Infoway has provided funding to support the implementation of a personal health record for the province of Newfoundland and Labrador. A personal health record is a computer-based medical record that securely holds all or a portion of the relevant health information about an individual over their lifetime and is accessible by the individual. PHRs can integrate with health systems such as hospital information systems, provincial health systems, and sometimes clinic EMRs. Providing citizens with access to their health information and reliable health educational materials, as well as links to other online health services, can result in some of these following benefits. With easy and direct access to prescription information, citizens can be more equipped to manage their medications effectively, increasing the likelihood of renewing their prescriptions on time. Allowing citizens to access results independently will empower them to better self-manage chronic disease and be proponents of their own health. The PHR will ensure citizens always have access to accurate information, preventing the information from getting lost in translation from the provider visit to home. By knowing their results and being able to see trends in their results, we can expect citizens to have more informed conversations with their providers. Unnecessary trips for healthy visits to their family provider can be prevented, saving transportation costs as well as providers' time. Access to health information directly can also improve continuity of care, especially for those citizens without a family physician. And through our access and consent management processes, the PHR will improve the capability of sharing health information with family and caregivers. The PHR project is creating the foundation to provide citizens of the province access to their health information as well as other health-related platforms. Citizen access to personal health information is achieved through the integration of data from well-established sources. These sources include the client registry, which is the provincial registry of patients, the provider registry, which is the provincial registry of health providers, the drug information system or pharmacy network, which receives information from community pharmacies across the province, as well as the MyHealthNL clinical data repository, which receives reports and results from each of the RHA health information systems. The scope of the first phase has been determined and defined, but we are continuing to consult with providers and citizens and the project steering committee to inform the scope of future phases for PHR. When first implemented, the PHR will provide access to the following: lab results, so your general lab, blood bank, micro, pathology, etc. Medical imaging reports, such as X-ray, nuclear medicine, ultrasound, etc. And a medication summary, which will show medications dispensed by the pharmacy, as well as any allergies recorded by the pharmacy. As a result of consultation with citizens and providers, at this time, laboratory results will be released to the PHR 7 days after they are available to the health information system. Pathology and medical imaging reports will be held for 14 days before release to the PHR. In addition, some of you may have been involved in our early engagement sessions and learned of a secure messaging feature within the PHR. This secure messaging feature, however, has been removed from the initial deployment due to concerns from stakeholders and some limitations in the functionality. In addition to these reports and results, citizens will have a direct link to the online e-mental health service, Bridge the Gap, as well as a link to HealthWise, which is an external library of health-related information to help inform and support them as they adjust to having direct access to their personal health information. A significant piece of work during the early days of this project was the completion of patient and provider engagement sessions. The next slide will speak to the format and the importance of this exercise, but we also want to recognize the significant marketing and communications efforts that will be required throughout the course of the project. So NLCHI will be working with the communications team at the Digital Government and Services NL, as well as the Department of Health and Community Services, to help inform the citizens of our province about the upcoming availability of the PHR. Lastly, a vital part of providing access to health information online is to ensure positive patient identification is verified when accessing the PHR. NLCHI is working with the Office of the Chief Information Officer and leveraging the MyGovNL solution, which is the site that many citizens use today to renew their driver's license or MCP, to ensure privacy and security are maintained when accessing the PHR. So over the past year, a team from the University Health Network led a series of interviews and engagement sessions. These sessions allowed for feedback on features of the PHR and highlighted the potential benefits and challenges to implementing a PHR. So during the first phase, the immersion process, internal and external stakeholders were interviewed. A report of key findings was provided to the project team to help evaluate and identify key sponsors and champions for the change and highlight areas that may need increased communication and engagement. Next, a diverse group of 16 citizens were individually interviewed regarding their experiences with healthcare in the province, their thoughts on having access to their personal health information directly, as well as the challenges that they may face. Also, as part of this discovery phase, 4 focus groups with physicians and nurse practitioners were conducted. These interviews and sessions provided guidance for the project steering committee, as well as laid the foundation for the third phase of the engagement work, the co-design workshops. These workshops brought together citizens and providers to share the insights that were gathered from each group and to work through strategies to address some of the challenges identified. The facilitators of these engagement activities have provided the project team with an insights report, which included recommendations regarding configuration and suggested future enhancements, as well as content that will help guide change management activities.
Throughout the fall, we will be engaging with groups such as yourselves and continuing conversations with patient and provider groups as the project work progresses. Throughout the winter, you will see further communications as well as a public awareness campaign for the PHR. The goal will be to implement a limited initial deployment in early spring, followed by an evaluation and then expanded availability to citizens of the province. This diagram represents the key areas of priority for our PHR roadmap. It is far more extensive than what this current project will deliver, yet it's important to provide content around the broader vision of our PHR. This project will start with building the foundation. At the center is the PHR, MyHealthNL. The outside circles reference the key pieces of information and functionality that will be delivered as part of our strategy. Some of these services will be delivered by our PHR vendor, Orion. Others will require partnership and integration with other vendors in the healthcare system. The ongoing expansion of services and functions in the PHR will be defined through continued engagement with citizens and providers, as well as formal evaluation processes as the program develops.
Now that you have some more insight into what the personal health record will bring to your patients, clients, residents, we'd like for you to think about the impact that this will have on your day-to-day work. Will it require a change in any systems, tools, or processes that you currently use? Will it change your job role in any way? And if so, how? Will it require a shift in thinking, behavior, or mindset within your practice? And lastly, in preparation for the PHR becoming available to citizens, what can we do as an implementation team to help you in your practice with this transition? So we're happy to hear your feedback now during our presentation time that we have left. But we also do have an email address. I'll just flick forward to that slide for a moment. So if you do think of questions or feedback that you would rather send to us privately after the session, you can email us at myhealthnl@nlchi.nl.ca. I'll give you a chance to write that down if you wish.